Hi there, and welcome back to my virtual Salt and Soul studio. My name's Alexa, and I'll be guiding you through this flow today. I am a doctor of physical therapy as well as a yoga instructor, so I will always be preaching the importance of movement. Today, we're going to go through a gentle yoga flow that's designed to improve your spinal mobility, open up your tight hips, and engage those muscles that support your low back. So, if you have low back pain, any stiffness, you work at a desk, this will be a great flow for you. However, this is not to diagnose or provide medical advice to anyone. So, if any of these movements or postures increase your symptoms, worsen your low back pain, cause any numbness, tingling, please stop and maybe see a medical provider for more tailored exercises for you. With that, we'll get started on our backs. So, you can join me as we roll over. You can keep both knees bent and just find your way onto your back here. We're just going to start off with some breathing, some grounding down here. So you can place both hands right at the bottom of your ribs where your fingertips are still on your belly here. Maybe letting those eyes fall closed. We're going to walk those feet in toward your bottom, just finding a comfortable position here. And from here, just take a nice deep inhale through your nose, fill up. Feel the air pressing into your ribs, opening up. Exhale through your mouth. Feel that air move into your fingertips where your belly is here. Again, in through your nose. Exhale through your mouth, let it go. Just taking a few more breaths here. Finding a comfortable, natural rhythm of your breath. Pushing off any other thoughts to the side for later in the day. Just trying to be present with your body. From here, you can bring your hands down to your hip bones, placing your fingers on your hip bones and your thumbs down at your lower back here. We're just going to go through a few pelvic tilts here. So pretend you have a coffee cup that's resting gently on your pelvis here, just neutral spine. It's not tilted either direction. And now I want you to tilt that coffee cup so it's going to pour the coffee. So it's going to roll down your belly toward your chin. On your exhale, let's switch it. We're going to tilt that coffee cup the opposite direction. Maybe a slight arch in your low back here, feeling it come off the ground. And inhale, switch it. We're going to roll, squeeze those glutes. Let that coffee pour toward you. And on your exhale, tilting down and away, dumping that coffee the opposite direction. One more round here. Inhale, pour that coffee towards your mouth. Exhale, dump it out the other direction. Let your low back arch here. And then just come on back to neutral. That coffee cup is empty. Just let it rest here for a moment. We're going to release those hands and place them down by your sides. Palms are facing down. Finding a comfortable position with those feet here, maintaining that neutral pelvis. So we just have a straight line going across. We're not arching in either direction, so we're not drawing that whole low back. Just a gentle lift right here off the ground. And when you're ready, I want you to inhale to prepare. On your exhale, lift those hips and pelvis up toward the ceiling, maintaining that level line right here. Don't let either hip drop. And slowly lower back down. Inhale to prepare. Exhale, come back up into your bridge. Inhale to lower. Exhale, rise back up. Just activating some of those muscles, the glutes, the core, those deep core stabilizers here to support the low back. And exhale, rise back up. Inhale, lower down. It's okay if your toes lift here. We want the weight to be going through the heels. Exhale, rise back up. Go through 2 more here. Inhale, lower. Exhale, rise. Inhale, lower. Nice job with that here. Next up, we're going to come into some knees to chest. So when you're ready, send your left leg long, keeping that right knee bent. And then we're going to hug that right knee into the chest, wherever you can grab onto, even if it's lower down. If you can't quite make it all the way up, you can just grab for the back of your thigh here, whatever is accessible for your body. And from here, you can just gently rock side to side, opening up that hip here a little bit. Just getting a comfortable movement. Maintaining that natural breath. Oftentimes, when we have higher pain levels, can use your breath as a tool to reset your nervous system. Can think of your pain response being like a smoke detector that's overly sensitive. So it's going off, it's causing pain, but there might not necessarily be a fire, there might not be smoke. We might just have an overly sensitive smoke detector, aka your nervous system. So we're just trying to retrain that movement is okay. Movement doesn't need to set off the smoke detector. From here, we're going to switch it. So send that right leg long. Hug that left knee into your chest. Same thing here. Can grab behind the thigh or hug that knee in nice and tight, whatever feels good. And then we're just going to gently rock side to side for a few breaths here. You can keep your eyes closed, have a soft gaze. One more full breath here. And then you can also hug your right knee in. So we're going to have both knees hugged into the chest here. If you're able to, you can try to interlace your hands if that's too much. Maybe just coming for down under the thighs here. And one more time, we're just going to rock gently side to side. Just reminding your body that movement is okay, movement is safe. And movement is oftentimes the medicine your body needs, especially when you're feeling stiff, achy, having any pain in that low back. These are going to be the best stretches for your body. One more full breath here. And then last one on our back here. If it feels accessible, you can reach between your knees, seeing if you can grab for the outside edges of your feet. We're going to find happy baby. So just gently bending and extending those knees within a range that feels comfortable for you. If you feel any popping or cracking sensations, that's totally normal if it's not painful. If it's super painful, you should probably back off. But you can just keep going with these, trying to slowly increase that range of motion. And if this feels like too much for you, then you can just try planting those feet on the floor and finding a gentle windshield wiper, just dropping your knees one side to the other as such. So wherever you are, either happy baby or this windshield wiper position, let's just go through one more full breath. And then both feet come back down to your mat, to the ground. Knees are bent. We're going to gently roll over onto one side. And then make our way all the way into a tabletop position. So once we're in this tabletop position, we're going to stack the knees directly under the hips, hands come under the shoulders. And from here, we're going to go through some cat-cows here. So just going to do some nice spinal mobility. On your inhale, drop your belly, gaze goes high. can press back a little bit as you see I'm doing here. And inhale. Exhale, arch your spine, look between your thighs, and find your cow pose. Inhale, drop that belly, gaze comes high. Cow. Exhale, arch your spine, look between your thighs, finding cat. You can keep going with these, matching your breath with your movement, just rinsing out the low back. One more full round wherever you are. And then we're going to meet back in this neutral tabletop position. So I want you to actively engage your core by gently drawing your belly button in toward your spine. Hold this position here. We're going to find a balancing table. So when you're ready, send your left leg long behind you, but don't move that position of your hips and pelvis. Want right here that core to stay in the exact same spot. You're going to keep those toes flexed on that left foot, and then see if you can reach your right arm forward just for one breath. And release, bring everything back down to the mat. Go through a full cat-cow here. And then repeating on the opposite side, engaging those deep abdominal muscles that support your spine. So on your next inhale, send that right leg long behind you. Exhale, flex those toes. Keep that pelvis in the same position. And then reach your left arm forward. If this is too much, just keep the leg up. Full breath. And drop it back down to center. One more cat-cow here. You can tuck those toes behind you and press back into a downward facing dog. We're going to keep those knees bent here. Don't worry about straightening out your legs. Gaze is going to be high between your thighs here, and see if you can actively press your chest back toward your thighs. Tippy toe walk toward your hands. And then we're going to heel toe those feet just slightly apart here. You can grab opposite elbows and just gently rock side to side, finding a rag doll. Keeping a generous bend in those knees. You can gently play around with straightening them out. Just stretching out those hamstrings. Especially if you work at a desk or you are sitting a lot of the time, this is a wonderful stretch for you. If this is too much, you can always just bring your hands to your knees and just find a gentle stretch so you feel toward the back of your thighs here. If anything is too much, causing any tingling or numbness, please back off. And then from here, we're going to find a forward fold, bending the knees so your hands can reach the ground. Heel toe your feet in to touch. Inhale, we'll find a halfway lift. So gaze is forward, back is flat here. Exhale, one more forward fold, just melt down. Inhale, bring your arms overhead, tall mountain. Exhale, hands come down through heart center. By your side Tadasana. Shake it out. Thank you guys so much for practicing with me today. I know this was a little bit different than my usual, but this is definitely something I want to harp more on. So I am a movement specialist. I am here to help people with pain and aging with confidence and getting back into whatever form of movement feels best for your body. So if this felt good for you, make sure to save it, try it a couple times this week, and let me know if it helps you. But otherwise, I hope you subscribe to this channel, and there will be tons of more educational content and videos and flows like this so that we can really get to the bottom of everyone's pain and see how we can get you moving as effectively as possible. Have a great day. Thanks for joining me.